Today is Overdose Awareness Day here in the U.S., and it's a crisis growing out of control as the FDA works on a plan to prevent more overdose deaths. Data shows they're reaching a new high. Some lawmakers are pressing the FDA to take bolder actions. Others are taking matters into their own hands and creating these new task forces to combat the crisis. NewsNation's Natasha Zuves joins us here in studio. And Natasha, you spoke to some of the people fighting the crisis in our neighborhoods.
Yeah, that's right, Nicole. We're staying on top of the explosion of fentanyl. No neighborhood immune to the nationwide opioid crisis. And there's an economic as well as a human toll. Fentanyl, the leading cause of a death in U.S. adults aged 18 to 45. And leaders in Arizona now saying the epidemic cost their state more than $50 billion last year. They say that number factors in overdose deaths, reduced productivity and quality of life for those with addictions, as well as expenses Arizona faces as a border state. And as the number of overdose deaths continues to climb, some local governments fighting back, taking aim at pharmacy chains. In Ohio, a judge ordered CVS, Walgreens, and Walmart to pay more than $600 million in damages. Increasingly, it's down to individual communities to fight as hard as they can.
The pain is just unbearable.
Last June, Megan Short lost her 26-year-old son, Billy Sissel, after he overdosed on heroin laced with fentanyl.
It can happen to anybody. He was a father. He had a 3-year-old. He was a big part of our family.
A crisis out of control in every American neighborhood. According to the CDC, there were an estimated 107,622 drug overdoses in 2021. That's a 15% increase from 2020. 66.5% involved the synthetic opioid, mainly fentanyl. The biggest percentage increase occurred in Alaska, where deaths are up a staggering 75.3%. Now, it's so often coming down to local governments to fight as hard as they can to save their communities.
In Houston, we're estimating it's 3 people per day. Just fentanyl alone, just fentanyl.
Joy Alonzo is the co-chair of the opioid task force at Texas A&M University. Their biggest challenge, lacking the funding to keep up with the demand for naloxone.
Kids can buy these counterfeit tablets and they look really good. I mean, I've been in the medical field for 40 years and I can't tell the difference.
Another way local governments fighting back, taking aim at pharmacy chains. More than a dozen counties in Illinois now suing after similar lawsuits in Ohio, where a judge ordered CVS, Walgreens, and Walmart to pay more than $600 million in damages. I spoke with Gerald Posner on Weekend Prime. He's been tracking fentanyl for more than 30 years. He says there are many parties involved, but explains counties are saying pharmacies should be the last line of defense.
If there are too many pills being sent into a specific town, you're the pharmacies that are supposed to say, no, we aren't going to fill them.
According to the CDC, more than 250 Americans die every day from an overdose. It's easy to get lost in the numbers of this crisis, to forget that every statistic represents a family left behind. Megan sharing how she remembers her son.
His one thing that was important to him was just making sure that everybody was happy and smiling.
And the White House releasing a statement today in part that today is a moment to, quote, honor and remember those who have lost their lives to the drug overdose epidemic. And Nicole, an untold number of families mourning today and every day. And the battle continues in so many neighborhoods across our country.
Yeah, Natasha, it certainly does. Our communities may be taking other action to try and help.
Yeah, absolutely, Nicole. There are so many strategies. I actually want to show you what they're doing in South Austin. It's a Narcan vending machine, the first one in Texas. This is on the side of a church. It is free. It provides access to the overdose reversal medication anytime, day or night. And then there are also fentanyl test strips. I want to show you, this is a piece of paper the same size as one. You can see how small and portable it is. It can detect in just 5 minutes if fentanyl is present. And in the Bay Area, for example, one organization says there's been a 46% increase in demand for the strips in just the last 4 months. But then, for example, in states like Florida, those test strips are illegal. They're considered drug paraphernalia. Nicole?
Yeah, some important information there. Natasha, thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.